position the patient in the prone position on the operating table. Identify the spinous process of the level to be instrumented using palpation and intraoperative imaging. Make a midline incision about 3 centimeters in length, exposing the spinous processes at the correct level. Depending on surgeon preference, the supraspinous ligament may be left intact, reflected, or removed entirely. If a decompression procedure is desired, care must be taken as to not remove excessive amounts of bone. Aggressive bone removal may also increase the chance of fracture of the adjoining spinous processes and posterior arch. If the facets are hypertrophied and do not allow for proper anterior placement of the implant, the facets must be trimmed. Attach the dilator to the gray handle. Insert the initial dilator and puncture the intraspinous ligament, placing it as far anterior as possible. Using the spreader, determine the appropriate size of implant. Insert the spreader with the ratcheting arm open and compress to feel the tension. Once the desired tension is reached, close and lock the arm. The placement of the arm will indicate the size of the implant needed. Using the size indicated by the spreader, attach the corresponding size rasp to the gray handle. Insert the rasp into the interspinous space and rotate the instrument cephalad to caudad, decorticating the spinous processes. Remove the rasp and slide the corresponding sleeve. Reinsert the rasp and sleeve together into the interspinous space. Keeping the sleeve in place, remove the rasp. You have now created a cannula for the post-plate side of the implant. The Aspen Spinous Process Fusion Plate is intended for use with bone graft material and is not intended for standalone use. The post-plate component of the implant may be packed with chips, flexible cancellous, DBM, or other bone grafting material. Attach the plate post body of the implant to the plate post body inserter. The small pins on the inserter tip engage the slots along the top aspect of the post plate. The adjuster knob must be tightened fully to secure the implant to the inserter. From the opposite side of the cannula, introduce the post plate body of the implant. Rotate the implant into its final position while simultaneously removing the sleeve from the interspinous space. It is important to note that the implant may be placed from either the right or left side of the patient. It is anatomically preferred to be placed from the left. If doing a multi-level placement of the Aspen, the implants should be placed cephalad to caudad and implanted from the left. Attach the mating lock plate to the lock plate inserter. The peg side of the inserter fits inside the set screw, while the curved portion surrounds the set screw housing. It is important to ensure that the set screw has been slightly backed up to allow the plates to slide together. Slide the corresponding lock plate over the plate post until it comes in contact with the spinous processes. Before compressing the plates and tightening the set screw, ensure the device is placed as far anteriorly as possible and that the plate does not protrude above the lumbodorsal fascia. Also ensure that the fixation spikes have securely engaged both spinous processes. The lock plate will angulate up to plus or minus 10 degrees in the coronal plane to accommodate the bony anatomy. Align the conical tips of the compressors into the lateral divots in each plate. Prior to applying compression, it is preferred to remove the lock plate inserter. It is also preferred to take a lateral X-ray prior to compression to confirm proper positioning. Using the compressors, clamp the plates against the spinous processes, driving the spikes into the bone. Squeeze both compressors simultaneously or alternate back and forth to ensure the spikes seat properly in both the inferior and superior spinous processes. Attach the set screwdriver to the 30-inch-pound black torque handle. While maintaining compression on the plates, tighten the locking set screw until the torque handle clicks twice. Remove the compressors. Visually and manually inspect the plate to confirm secure fixation. Check placement of the device using X-ray or guidance equipment as needed.